Good evening. The time is 6:01. I now call this meeting of the Tewksbury Board of Health to order. Please note that this meeting is being recorded and will be available for public viewing. We will begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So let the record show that all members of the board are present. So we do have a quorum. Next item on the agenda is the approval of minutes from our last meeting on July 25th, 2024. Are there any corrections to the minutes? I believe none. Hearing none, I'll entertain a motion to approve the minutes as presented.
I motion to approve the minutes as presented.
Do I hear a second?
Second.
Second. It has been moved and seconded to approve the minutes from July 25th, 2024. Is there any discussion? Okay, I hear none. No further discussion. We'll proceed to vote. All in favor say aye.
Aye.
Any opposed say nay. I hear none. Minutes are approved. I also approve the minutes, my bad. Chair also approves, so all done. So next on the agenda is the water quality concerns. So we have the director of the DPW, Kevin, and the town manager, Richard Montori, with a public session first. But first we're going to hear from them. So thank you guys for coming in. I appreciate it.
Not a problem. Thanks for inviting us. How would you like us to start? What would you like us to?
So originally, the goal was to have public questions regarding any water quality concerns. However, I do not see anyone in the audience today. With a lot of discussion in the background of all the water things, I was hoping that people would come to ask their questions. I do know that I did see a few online. And I don't know if the board has any. I have some questions. I know we had spoken prior. So if you'd like to just first kind of go through what happened, I know everyone knows, but like the process of, we're going to mainly stick with quality of the water.
Sure.
For health and safety reasons, and the quality of the water and how it's tested. So if you can kind of go through that first, and then we can go through questions from the board.
Sure.
All right.
So as everyone knows, we had a major water break on the 27th of July. It occurred based on what we have for information at the water treatment plant about 5:30 in the morning is when the call came out that there was a major water break. We tried to quickly isolate the location, turn the water off, and then make a repair. That repair was made by around 2:30 that afternoon, and as soon as we isolated it, right around 11:30, water was restored to the majority of the town. But the problem we had was, because of the size of the water main that broke, an 8-inch line, it was closely connected to a 20-inch line. There was a significant amount of water lost throughout the system. That meant that the velocities of the water going through the pipes was increased, sometimes 2 to 3 times what we normally would see. Therefore, the inside of the pipe was scoured, and any sediment that may have been in the pipe, or phosphates or nitrates, were pulled out of the pipe and churned up within the system, and therefore we had a lot of brown water within our system, which then took us several days to isolate the brown water and directionally flush, which means we turn off valves in certain areas where the system is looped so that we can force the water in a certain direction to open hydrants to get that brown water out of the system, and then to not introduce brown water into areas that we had already cleaned, which is why it took us several days to accomplish that. And then, once that was done, we, moved on and, completed our work and got the system back up to normal.
Thank you. Does anyone on board have any questions that they would like to ask?
Yes, I have two.
Mr. Manager, since 2018, do you have an estimate or how much the town has spent on the wastewater treatment facility?
On the water, you mean?
Yes.
I do. We spent, since 18, we've spent, the town has spent about $20 million of town funding, and we had another $9.3 million in opera funding that we used on water. So I would estimate since 2018, about $29 million. Since 2000, actually, let me go back. Since 2018, 2, 4, 5, let me go back to 2012 is probably the easiest because that's what my numbers are looking at. We spent $32.5 million on water improvements. 23.2 is from the town, and 9.3 is federal opera funds. Since 2018, we have spent about $15 million.
Thank you very much. Kevin, question. Thank you for attending, being with us. I looked through this, but what I wanted to kind of find out is, if I'm correct, that there's one is a test a year. What I'm looking for is if you could send the board, coming up in the next couple of years, when the schedule of testing is. That's what I'm looking for, but I just
So-
didn't know if it was once a year.
No, it's a good question. So we test for different chemicals and constituents at different intervals. The water at the treatment plant is tested every 4 hours. And we continuously test before and after every process within the treatment plant.
Oh, wow.
So we test not only the raw water coming out of the Merrimack, the finished water going out of the plant, but every step along the way, we have a lab set up to test for that. There are other tests, such as lead and copper, that we test every 3 years, and other things like that. But, for the most part, the drinking water is tested for every 4 hours at the plant. Additionally, every week, we test about 30 locations across the town buildings as well as private residences, once a week.
Thank you.
Yeah, that's great information, and that's something that I love the residents to hear, because the question is, what are we doing? And today, I'm excited that you're here because I want them to hear what I heard. And I feel so much better being educated on what is being done and how we work our system. So,
And if I can just
thank you.
follow up on that, in the DPW's 5-year capital plan, they have $5.4 million a year in water distribution improvements, which is approximately 3 miles of pipe a year that they'll address. So in addition to the $32.5 million we've spent since 2012, the plan is to continue with another 5.4 each year to make sure we improve our water system. And we're actually looking at even increasing that amount as we look at the future 5 to 10 year plan for the town. So we are trying to address it. It's an old system. I don't know if you want to go through some of the pipe that we have in the system, that how old it is. But we are addressing it. We're not just we're doing the normal testing and improvements with the water treatment, but we're also working on the infrastructure and the pipes in the ground.
Do you have any questions?
I'm all set.
I do have one question, which you may or may not know the answer to. I know that you just said that you're getting ahead of the infrastructure. How old, if you had to guesstimate, how old do you think the pipes would be? And are you ahead of it to prevent another, hopefully not catastrophic, breakage?
Good question. So the town's original water system was constructed between 1951 and 1953. When that project completed in 1953, they had put approximately 66 miles of water pipe in the ground of asbestos cement and 1,300 services to the residences and buildings within the community. Since then, they transitioned over to cast iron pipe and expanded the system up until around the early 80s. And in the early 80s, ductile iron pipe became the best choice for pipe, and that's what we transitioned to then. There's approximately 160 miles of pipe in town. 49 miles of that pipe was installed in that first phase from 1951 to 53, and that's asbestos cement. That pipe, at best, will last 50 years. So that should have, give you an idea of the age of the system. The pipe that broke on the 27th of July was asbestos cement. That gives us the most problems in town, and that's what we really focus on replacing. In addition to that, part of that original project, as many of you know, South Tewksbury were a lot of camp lots, right? Narrow streets, short streets, things like that. And when there were very few homes to serve, they used wrought iron pipe, which has a very short life, maybe 25 years or so. We've gotten the majority of the wrought iron out of the system, but there are still some sections of wrought iron that we're focusing on in addition to the asbestos cement. But, like I said, the age of the system, 49 miles or so, is close to 70 plus years old.
So are you keeping an eye, like an extra eye on those problematic pipes, just like kind of?
Yes, we have everything mapped in GIS as to the
That's
pipe
awesome.
size and the pipe type.
That's
And
awesome.
in addition, we track all of our water breaks and map that in GIS, so we know what areas are giving us the most problem, and we track all that.
Thank you for that.
Cool.
So I'm going to ask a few questions, and I know we had went through this too, but I just want it so that if anyone does decide to listen and hear, they have the answers, and we can always reference it back. So can you explain the current water treatment process in Tewksbury? Like, in short terms, yeah. I know you had said like every 4 hours, but can you kind of go through how you explained what the phases are and how it's?
So to kind of generalize, and I'm not a chemist, so I'm not going to get into too much detail, but the main process that we use is an activated carbon filtration with both activated carbon and sand media, and that's towards the end of the process. Earlier in the process, we use flocculants to get some of the sediment out of the water. Our water is drawn from the Merrimack River, and as you know, the Merrimack conditions can change on a daily basis depending on, the weather, what's happening upstream, things like that. So we have to be ready to pivot and adjust our treatment process. But like I said, the majority of it is removing the sediment with flocculants and then the sand filtration and activated carbon filtration.
Okay. Thank you. And then seasonal variations, are there any noticeable changes in the water quality during different seasons?
There are. And, like I said, when you have different weather patterns, heavy rains cause a lot of runoff. Other communities such as Lowell have, combined sewer systems where their stormwater goes to the sewer treatment plant, and then that, runoff gets flushed out into the Merrimack. And we see that at the water treatment plant when we're pulling our raw water off the river. We see those changes in, when there's snow melt, when there's heavy rain, when there's drought, and we always keep an eye on those conditions.
Okay, and so how do you manage that? As far as, do you just go through the whole same system of the treatment process?
Yes,
Okay.
our treatment process does not change beginning to end, but the chemicals we have to add to the treatment system vary depending on what we get out of the raw water.
Okay.
And like I said, there's, up at the treatment plant, we test every 4 hours. We test the raw water to understand what is coming off the river. Then it goes through the first process, and we test after that to see, what the flocculants removed, what still remains, so that we know, how much of what we have to add to our treatment process in order to get everything out of the water.
Okay. And then I did notice this question on social media, someone said that they couldn't come, so I did notice it, so I wanted to just mention the question. They said that the question was, I understand that the water is tested before distribution and is considered safe. However, once it has traveled the distances to homes where it is used, just what would testing reveal at that point? Is it really still safe?
That is a great question. So what I can tell you about that is, like I said earlier, we test about 30 locations throughout town every week. So I know Town Hall gets tested, the Annex, DPW, the fire stations. So we have areas up north, we have areas in the middle of town, we've got areas to the east, to the west, and to the south that we're testing on a weekly basis to make sure that the water that's coming out of the plant at the highest quality is still getting to the residents throughout town at the high quality.
Okay, thank you. And then a couple more questions. So I looked up EWG reports, and federal limits for many water contaminants have not been updated for over 20 years. How does the DPW ensure that Tewksbury's water quality meets modern health standards despite outdated federal limits?
So obviously, we're required to meet the state and federal drinking water limits for contaminants, which we do.
Okay.
And I understand that those haven't been updated in several years. One thing that we are part of is the PFAS testing.
Yes.
I don't know if you're familiar with that, where EPA has required certain communities who serve a certain number of people to test for PFAS, even though there is no reportable limit and things like that. But we still are performing those tests, and really to give EPA an understanding of the baseline of what's happening in drinking water across the country. Another thing that we do is we do test and we do track for different chemicals. A good example is when we filled the Astle Street tank. After we rehabilitated it, we had the whole thing cleaned, recoated, and it was ready to put back online. We chlorinated it, filled it, and then let it sit the required amount of time, drew a sample, and it was clean per EPA standards with the testing that we performed. However, with the VOCs that are related to the coating materials, the paints and things like that that are used, we knew that those VOCs can lead to exceedances in TTHMs.
Yep.
So even though the test came back that we could put that tank into service and use that water, we made the decision to drain the tank and refill it, flushing those VOCs out of the system. Even though there's no reportable concentration that we were in exceedance of, and per the EPA, that water was safe to drink, we knew that it could cause us issues down the road, and result in TTHMs in the system.
And then as far as, I know that we have the consumer report that's mailed out to everyone. If someone wanted and they don't know where this is or they don't remember getting it, where can they find it, or where can they get a copy of it so they can?
So electronically, that is on the town's website. We also have copies at Town Hall upstairs, as well as at the library. And you can always come to the DPW. We have copies at the counter.
And if someone needs one mailed to them, they can contact my office, and we'll be glad to mail it to them.
Okay, great. Thank you. I appreciate your time. Does anyone else on the board have any other questions that they'd like to ask? Okay.
I have one more. I was thinking about not asking it, but Kevin, based on I'm not being a scientist, I'm just wondering, do you feel that New Hampshire's regulations are less or more than Massachusetts?
Unfortunately, I can't speak for their
Okay,
drinking
I
water
just wanted
regulations
to,
as it relates
because
to
I don't feel they
Massachusetts.
are, but I just wanted to ask because it comes down the river.
Yeah.
Thank you.
And then just one more thing that we had spoken about too, as far as the whole part of safe water, even when it's brown. Can you explain what you explained to me as far as what that means? And when you say that it is safe, to what that actually means for the consumers out there?
That's a great question.
Thank you.
So when we say that the water is safe to drink, we don't recommend that you start, cooking dinner for your family and inviting people over and cooking pasta, things like that. What we're saying is, if you were to come inside, grab a dark cup, grab a glass of water and drink it because you're really thirsty, it's not going to harm you, right? We don't recommend you drink the water when it's brown. Let us finish flushing the lines. Let us, make sure that you have the highest quality water. But it is not a health hazard to drink that water.
Thank you. I appreciate that, because that was one of the things that I would see a lot, and obviously, so that was really, important to understand that if you do drink it, you don't need to go to the hospital emergency room. However, try not to drink it as much as
Right.
possible and drink clean water for sure.
We reworked that message.
I appreciate that very much. Thank you both for your time. It's very informative. I hope people do hear this and at least understand, and if they would like to get more information, to reach out.
They can always reach out,
and-
definitely,
And
yeah.
go to the DPW and things like that, so.
And if any of the board members have any questions, feel free to reach out to us directly. We work closely with Shannon and keep her informed of any water breaks that are causing issues to restaurants or food establishments. So any questions during an actual event happening, feel free to email or call, even if it's at night or on the weekends.
Awesome. Thank you, guys.
Thank you
Appreciate
so
it.
much.
Thank you very much.
Thank you.
Thank you.
All right, so the next section was for public questions. However, I see no one in the audience, so we'll just move to the next. So next on the agenda is reports, so Health Department reports. I will go to Shannon.
So I'm just going to piggyback off the water main break. So when that happened, we had many restaurants in town that didn't have water. And we were informed that some of them stayed open without water. They were using bottled water. However, that's not approved. You need running water and hot water to wash your hands, flush toilets. If you're touching ready-to-eat foods, you are not washing your hands properly. So I had discussed this with Melissa and Susan, and upcoming permitting season is in November. And with our online system where we do the permits, I was going to have each establishment upload their emergency plan. So that way we can review it internally at the department to make sure their plan is actually, would meet code if they were to stay open during an event such as this. Even if they don't have power for some amount of time, hopefully they would stay closed and know what to do. So hopefully with that, we can capture that audience and have them understand the public health risks when they stay open. I do want to mention, as part of our food inspections, we've been running into issues with there not being a certified food safety person on staff, even though the board has required that as their part of the regulation. And it's been pretty frequent the past month or so, including today. So that is something I need to figure out how to also handle during permitting season and moving forward. Because I think obviously the lack of knowledge causes issues during operation.
I have a question. So when they renew all their licenses and permits, they have to show all of the certificates. Are they showing the certificates but it should have the right dates on them?
It's just
So-
when we show up for an inspection, oh, they just ran out, oh, I'm usually always there, but I'm not today, and that's the problem.
All right, because I know if Mayan is starting to go, I always get a message from someone
Yeah.
that says, it's time to renew it. So, okay.
So speaking of which, Jimbo's and Hunan Wok, I've spoken with both consultants. For Jimbo's, their consultant has been a little busy over the summer and hasn't really done too many inspections there. So I spoke with him today, and I said if he is unable to handle my request, that it is unfair to the establishment and they need to hire a new one. He's going to get me a plan of when he plans on doing inspections for the next few months. Hunan Walk, their consultant went twice this month. He said that they're doing really well, especially when the owner's son is there. I think he helps interpret better and keeps things cleaner and such in the restaurant. That consultant is the same one that was at the Jade East for over a year. COVID tests, so there's been a spike in COVID over the past month or so. So we were offered by the state to order free COVID tests, so if anyone's looking for a COVID test, they can come to the health department. We've been giving out 2 per household, so just come to the counter. Also, our Narcan program is going well. We have that box downstairs if any resident is looking for a Narcan kit. Mosquitoes. So over the past few weeks, there have been West Nile virus mosquitoes tested in surrounding communities, Tewksbury included in one of them. That happened last week. We spoke with Central Mass Mosquito, who does our testing, as well as our monitoring and spraying. They did a precautionary spray in the area where the mosquito is tested. I sent out a code red to the residents in that area so they were aware. If any resident is looking for their yard to be sprayed, they can go to their website or call them. Triple E is also on the rise, not necessarily around Tewksbury, but it has been in the state. I saw that a Board of Health had put a curfew on when people can be outdoors, such as sports. And I know back in 2020, we kind of had the same issue here with fall sports. So until there's a deep freeze, mosquitoes are always going to be a risk. You should wear protective clothing and use a deep mosquito spray to protect yourself. Any questions on the mosquitoes?
So you mentioned that there has not been in Tewksbury the Triple E?
Right.
Okay.
Siobhan is running a sober yoga event. This will be for Recovery Month, and that's on Tuesday, September 17th at Town Hall. If anyone's interested, we have a QR code on our Facebook page, or you could just call the health department to RSVP. The Dana-Farber mammogram van, we had this come last year to the senior center, which is like a mobile mammogram test that women can, or men can take advantage of. And that's going to be at the senior center on November 7th. We don't have the exact details yet, but I will keep you all informed. And that's all I have.
All right, thank you. Are there any questions from the board?
No, I was just going to mention that they did pass some legislation in the state about mammograms, and I'll bring that to the next meeting and text my director.
Great.
I'm sure that they're
Okay. All right, so next on the agenda is the subcommittee reports. So first would be microblading update.
Yes, so we've put together various information packets. The first one was basically what we found that other towns were doing, or recommendations that we wanted to set forth on what our guidelines, what kind of certification they need, licenses. So we gathered a lot of information. And the second thing that was just done was we broke down, we had made a decision that we were going to look at, instead of just having one license, like if most towns will choose someone who was in electrology, or someone that's an esthetician, or someone that's in cosmetology. What we were recommending is that we took 3, it's like really 4, of the different licenses, because there's a lot of people out there, and for instance, if somebody had a cosmetology license and they wanted to do microblading, if we only had one license that we were going to agree upon, then they would have to go back to school and basically learn the same thing that they learned for their cosmetology license. So what I did was I took those various positions, which was cosmetology, esthetician, and bodies, my mind just went blank.
It was body art, right?
Body art practitioner. And I broke down exactly what schooling they get to get their licenses and their certifications. So what I wanted to do is sort of table it for now. Everyone has gotten copies of it, and if we could all look at it and just really dive into the guts of it, because it's a lot, and come up with the final proposal for the town.
Okay. So are you making a motion to table that?
I am making a motion to table.
Do I hear a second?
Second.
Okay. It has moved and seconded that we table the microblading approval.
Yes.
So that the board has time to review and ask questions, any modifications.
And
Go ahead.
I'm sorry, and I just want to add to that. The goal that I think that Luke and I had was, again, to combine all of the different licenses together. So if someone had one of those 3 or 4 licenses, they were able to also become microblading practitioner. Okay.
All in favor, say aye.
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 Any opposed? I hear none. Chair votes aye as well. Motion passes to table. So next would be updates on Tewksbury Cares.
At this time, I don't have any updates. I'm still getting through that binder and trying to figure out where to kind of start with that. So I would like to table that again until I can
Okay.
get more information.
Is there anything that the board or I or anything that could help or assist that would support you?
I have things written,
Okay.
not with me, unfortunately. So yeah, I will definitely reach out to you
Yeah,
and let you know if I have any questions, but
absolutely.
thank you.
Okay, great. Any further discussion on any of these 2 items? Okay. So next would be old business, which is the tobacco regulation. To reinsert the remedial language in sections 12.20.1.1 and 11.20.2.1 to read, and a mandatory appearance before the Tewksbury Board of Health to explain the plan he or she has developed to avoid additional violations. And I'm going to pass that to Shannon to explain a little bit more and give a background, please.
So we have a tobacco control agent. His name's Ron Beauregard. He works for many communities surrounding here. And he kind of handles tobacco solely. And I believe it was last year the board had incorporated the updated state regulation into our regulation. And for some reason, this verbiage was left out of the regulation, which was discovered because we had 2 tobacco sales, which will be coming next month to the meeting. And he went to go write a letter and discovered that these words weren't in our regulation. So I spoke with town council, and he said that if the board agrees, we can just put it back in the regulation and have you guys sign it.
Clarification, did you say the next meeting to
Tobacco sales.
sales, meaning they sold underage?
I believe underage or didn't ID them.
Gotcha. Thank you very much.
Okay. So the next step would be for us to sign
I have it.
that. Does any of the board members have any questions in regards to signing this?
No.
No, I was concerned about it because I didn't vote for the package, but since it is from the state, I've decided I'm gonna sign it, so.
Okay, so we can go ahead and sign that at the end. Yeah, okay, great. Do we need to vote on that?
I think we do.
Maybe?
Okay, so let's, just in case to cover
I make a
all the
mo-
bases.
I make a motion that we add this terminology to the tobacco regulation that was voted in last year.
Great.
Second.
All right, all in favor, say aye.
Aye.
Any opposed? I hear none. Chair also in favor. So it passes. It moves forward. Okay, so next would be any board member comments? Anyone?
I had spoke to you about contacting one of the congressmen, and they're still getting together some information. I wish I could have brought it today. It has to do about legislation on money that we may be able to use for testing in future. I'm concerned about as a citizen, we can ask these questions anyway, so I don't feel like I'm going above anybody here. Asking about what the legislation is, because Congresswoman Trahan has done some good things with the water treatment plant in Lowell, but I'm also concerned, like I said, about New Hampshire and the water coming down. Are they working on anything to combine, to get money to, anything from cleanup to upgrading facilities or testing? So whenever I get that, I'll fax it to everybody, or, I'll get it to you.
Yeah,
I'll
and then we
get
can
it
put that on,
Shannon, and then she'll get it to the rest of the members.
yeah, and then we can put that for like updates or anything
Right.
for on the agenda.
Yeah, I'd like to have it, yeah,
Okay,
on
great.
the agenda.
So we can do that for like future agenda items?
Yes,
Yeah, so
please.
once you get that, all right, so any other discussions or comments from the board members, any announcements that they'd like to make? I hear none. Okay, so future agenda items, we can put that down as one.
Yeah.
Does anyone else have anything that they would like to input or see on the future agendas? Any questions, anything like that? Okay, I'm hearing none. All right, so the next meeting is scheduled for September 19th, 2024 at 6 PM here at the Town Hall. And if there is no further business, I will entertain a motion to adjourn the meeting.
So moved.
Okay, any second?
I second.
All right, it has been moved and seconded to adjourn. All in favor, say aye.
Aye.
All opposed, say no. Hearing none, chair also votes aye. Motion carries, meeting is adjourned. The time is 6:38 PM. Thank you, everyone, and good night, Tewksbury.